demonstrates a dedication and service to Pittsburgh and its people during these most difficult times. Awarding him the Mayor Sophie Masloff Employee of the Month Award for April 2020. Furthermore, declaring Wednesday, May 6, 2020 is Marky Pinchuk Day here in our most livable city of Pittsburgh. Congratulations, Chief. We don't have a plaque to give you because plaques apparently aren't essential businesses. So once they reopen in the north side, we'll have that printed and made for you. Before I turn it over to you, I want to turn it over to the director and to Chief Romano as well. These are two men who have spoken your praise since your promotion and have always stated the reliance that they have, not only in the work that you do, but the advice that you give them. We're at a good place right now. We are on the backside of what looks to have been a plateau at the end of April. And as we see these numbers continue to go down, it's a time of caution for us. It's not a flag that says we're ready to reopen everything, but it is an opportunity to start to see some things begin to reopen. And as that happens, this city, this region will be counting on your advice, working with medical experts, working with technology in order to be determined how our public health will always be at the forefront of the decisions that we make. Director?
Thank you, Mayor. Chief Pinchuk, congratulations.
Thank you.
The planning actually started for this event, I believe the third or fourth week in January, when the Chief of Staff and the Mayor came to me, and they had some concerns about what was going on in China. And they said that they were somewhat concerned about it, and so was I. And we began some initial planning. At that time, I went to Chief Romano from EMS, and I said, who's the best person you have regarding planning for a potential pandemic, which we hope would never come to Pittsburgh or the United States. And without hesitation, Chief Romano says, Assistant Chief Pinchuk, who had helped plan for the 2009 H1N1 and then 2014 for the Ebola, and he had all the plans ready to go. We had to do some revisions with Chief Pinchuk's help and emergency management and planners from fire and police, as well as the other departments within the city. As we came to February, the planning intensified, so did the concern. We started to prepare the first responders by providing them additional PPE, advanced training, and started to make sure our equipment and supplies was up to par. Everything from ordering additional supplies to making sure the equipment was well maintained and ready to go. Then came March. The concerns even grew further. At that point, as was described to me, the train was on the tracks. It was just a matter of when it was going to come to Pittsburgh. We started to work a scheduling plan to make sure that we could support the essential services, not only through public safety, but through all the departments within the city. We worked within the city's different departments, and the concern even grew more and more as we approached a large event of St. Patrick's Day. A decision had to be made as to whether or not large events was going to occur and what the safety concerns were. Coordinating with our external partners, Allegheny County Health and FEMA Emergency Management, a decision was made in the best interest of the public to cancel those events. We continued day to day with having daily conference calls with internally, externally, and as the mayor stated, hopefully we're on the back end of this, and hopefully there won't be a resurgence. But if there is, rest assured that Chief Pinchuk and Public Safety will be ready to go. With that being said, I want to take a moment and thank all the first responders, police, fire, EMS, and of course our healthcare community. A special thanks to the nurses at the beginning of Nurse Appreciation Week. It's a team effort. It's a unified response throughout the city, throughout the county, and throughout Region 13. And I'd also like to thank the public for their support and their understanding during these times that the unknown times that we faced. So with that, I will turn it over to Chief Romano of Chief of the Emergency Medical Services. Chief.
Thank you, Director. Congratulations, Mark. I was thinking this would happen after we had come out of the crisis, that I was going to recommend that this happen for you, but the mayor saw fit that this happened a lot sooner due to your hard work and everything you've been doing for this city. Just to recap, EMS is working at full capacity. We're responding to all details as we normally do during the pandemic, along with the additional calls that they generate. We run 2 additional units under Mark's recommendation to help support the on-duty units. At this time, all our workers are safe. There's been no problems. We keep check on them daily under Mark's guidance. He's been available for any questions for them with their before they go home to their family, or if they have any questions before they come into work. A great job by our EMS employees out there during this time also. But because of Mark's guidance and having that plan available, he said, I'll dust it off and have it ready. And I was able to tell the director that, and we were able to go. And under his guidance, I think we've done great things. We've protected our employees, most of the employees in public safety, and all the citizens of Pittsburgh, to the best of our ability because of Mark. And without ado, Assistant Chief Mark Pinchot.
Thank you, Mayor, Chiefs, Director. So just to give a little overview where our planning came from. Our original planning started actually back in 2007 for H5N1 influenza. We employed that plan in 2009 for H1N1 and did periodic updates over the years for evolving threats such as Ebola and measles even. So the basis of our plan, it kind of has 3 main areas. The first one is force protection, be able to keep our workforce safe, and we also expanded that to the rest of public safety and other key departments. If we can operate safely in the environment, we can go out and do what we need to do from a public safety perspective. The second part is surge staffing to maintain the same quality of care as we do outside the pandemic period. So we have a 3-level plan built, and because of the early decisions to enforce social distancing and lock down our communities, we're still at level 1 of 3 of that. Level 1, we have 2 specialist units. We call them ECHO units, or infection control teams, and they basically support the rest of the operation. They do training in the field. They address out of maximum levels of PPE and do high-risk patient procedures such as intubations or other airway skills. And they do disinfection and decontamination of units in the field. In addition, those units are doing some specialty things under expanded scope of practice. They go out on behalf of the Allegheny County Health Department and collect COVID-19 test samples from people in their home, and it helps with containment and mitigation. These people aren't coming out in the community to get tested. We also assist Department of Human Services in moving homeless or vulnerable patients to safe havens. So once again, they're not out on the street. So our protection plan has multiple levels, making sure our personnel have appropriate vaccinations for seasonal influenza, making sure we're screening our employees when they come to work, making sure we're screening calls at multiple levels, screening them at the 911 center, screening on scenes, using telemedicine to determine who needs to go to the hospital versus who can go home. And then the third part of the plan is really kind of maintaining the operation and altered standards of care. So we want to maintain the same level of care that we're doing for everybody. We want to make sure everyone gets the proper care based on their medical complaint. So one part of that is kind of just the telemedicine part to determine who's safe to stay home and who isn't. And the other part of that is just be able to operate in really high levels of protection and doing stuff really we've never done before. Doing resuscitations of really sick patients in full biohazard suits with respirators on and that kind of stuff. And that has gone very well for us. So it's an evolving process. We had a base plan. Some of it we kind of threw together really quickly during that second week of March when we had our first cases in Allegheny County. And I really give a lot of credit to our personnel out in the field. So much was happening at once. We were throwing out just very general orders, kind of skeletons of of improvised plans, and the people in the field took that and built a new doctrine for us that's worked really well. So we update this by day. We're lucky to have the very strong relationship we have with everyone else within the Department of Public Safety, that we're interoperable on this planning and we keep all of our people safe. We have very good relationships with the Allegheny County Health Department, Department of Human Services, and the hospital systems in the city. And we kind of work as one integrated team. And things change day by day with us. Every day we're reevaluating the information, the data, the epidemiology, and we flex things on the fly. So we feel very good what happened so far, but we're 2 months into maybe a 12 or even longer month problem. So we got to maintain our vigilance. We got to ask the community, even if we start moving into yellow at some point this month, that they be very careful with all the social distancing guidelines. And we still have a long way to go with this. So, Mr. Mayor, thank you.
Thank you. Chief, you got to take your proclamation.
Where's that?
The director?
Oh, there it is. Thank you.
Okay. I think that's it below. Isn't it? No?
That's okay. It's okay.
Well, first to the family, thank you for sharing them with the city of Pittsburgh. Like I said, we're very blessed with the people that we have working on our teams, and especially on the COVID-19 team. It goes across departments. There's a great cooperation between directors and chief and staff in order to be able to do what is in the best interests of the people of Pittsburgh. Chief Pinchuk is that point of the spear. I don't want to try to say that one city employee is above all the rest when dealing with a global pandemic. But if there were a face to be able to put on the city worker, the person that has taken this on at their own risk, and I'm sure you realize that too, it is Chief Pinchuk. And so thank you to his wife, to his daughters, for sharing him with the people of Pittsburgh and allowing him to use his talent to keep us safe. To the rest of the city employees, to everyone that is doing your job, whether doing it from home or doing it out on that street and dealing directly one-on-one with people who are infected. On behalf of the people of Pittsburgh, thank you. We thought that it was important to take a moment at this time as we can look back over the course of the past 10 days to 14 days of seeing that plateau of the numbers of hospitalizations and numbers of fatalities, and starting to watch as it starts to slow down, and understand there's a moment where we can thank those that are still out in the street and still working from home in order to keep the people of Pittsburgh safe. No matter what department you work in, no matter what it is that is your job as a Pittsburgh City employee, the first order of business is that we keep our people safe. We must have priorities. We must have a true north. And our true north is the people in the city of Pittsburgh will be kept safe. And for the work that you've been doing in order to maintain that, and the sacrifices you've been making in order to make sure that that continues, thank you. That concludes our ceremony today. We will stay around for questions from the media.
The media could just hold on a moment. We'll start unmuting you.
Yep, and Tim, do you want to do air traffic control on this?
Sure. People are just starting to be unmuted now.
Tim, did you like my use of the term air traffic control?
Let's hope air traffic control works better than I do. But okay, reporters, if you'd like to start asking your questions, go ahead.
Some other Pittsburgh public safety officials here on Cozy TV this afternoon. They did an Employee of the Month ceremony, and we're giving a bit of a update on the state of the city here in Pittsburgh and what may be to come here in the next few weeks.
Padilla, this is Ariel with WESA. I was just trying to see if there is any update about when the city might be reopening or when the stay-at-home orders.
Yeah, so obviously Ariel will follow the guidance and the authority of the governor and the State Department of Health and work cooperatively with the Allegheny Department of Health. Whenever the governor announces his plans for southwestern Pennsylvania, we are doing scenario planning for decisions in either way. So I think that we'll be prepared whatever he announces in the next week or weeks.
Mayor Peduto, this is Ashley Murray from the Pittsburgh Post-Gazette. I was wondering if there was any follow-up after your conversation last week with the Ways and Means Committee Chair, Representative Neal, and you joined other mayors, including Dayton Mayor Nan Wheely. Have you been in contact? I know you've requested directly to President Trump municipal funding for emergency situations. Have you had any follow-up?
I have the opportunity to serve in leadership with the National League of Cities and with the U.S. Conference of Mayors. Both organizations have combined efforts in order to be able to provide lobbying in Congress. It seems that the House of Representatives is willing to put forward another bill sometime, hopefully during the month of May, that would include provisions for states and cities. It still becomes a question of whether or not those provisions will be adopted by the Senate in a concurrent bill. We continue to work directly to try and convince locally Senator Toomey of the importance of all of Pennsylvania's cities, not just Pittsburgh, but Beaver and Butler, Washington and Newcastle, all of the areas in this state that would need assistance for what we are thanking our employees for today, the implementation of the operations in order to keep our people safe. That happens at a local level, not at a federal level. But most importantly is that the structure that we are given by the states in order to govern, to be able to provide street paving and playgrounds and fire departments, are all contingent on revenues that the cities have lost. And without revenue to pay the bills, cities throughout the country will face enormous deficits, as will states. And if we allow ourselves to bankrupt our states and our cities, we will never see economic recovery in this nation.
I saw on your schedule that you had a conference call on the budget, I think earlier this week or end of last week. Have you guys come to any decisions or thoughts on how you'll go about cutting the budget because of lost revenue right now?
Yeah, well, immediately we put in a freeze on all pay hikes. Earlier this week, we announced that we will be freezing all new hires, over 60 positions. We have asked each director and chief to provide 10% across the board cut to their budgets in non-personnel. And we are looking at potential attrition of positions first into our 2021 budget. As we look at balancing and being able to meet payroll by November, we're looking at the potential of having to dip into our reserve fund. We're looking at the elimination of using our PAYGO system in order to be able to do capital projects. These involve projects that are not eligible for community development block grant funding, that are not eligible for bond funding, that have to rely upon the cash out of our system to pay for. But for the next few years, we'll probably be having to use that in order to be able to make our ends meet. Our problem is not different than any other city in this country. It is only different by our neighbors in our suburban counties by the number of zeros.
Mayor Peduto, this is Amy Wattis from KDKA. Can you say specifically how much money the city has lost since the beginning of this pandemic?
We get basically a daily report on revenue in order to be able to follow cash flow. So week by week, it will vary. After the during February, our cash flow was off, but not off that much. During the month of March, our revenue plummeted, but we were also able to cut our spending during the month of March, understanding that we're going to be in this for the long haul. Now, under the directives that we've given to each department, we should see a continuation on the amount of spending cuts that will be effective in April. Although during April, there are a few spikes in certain revenues, whether those are income tax, obviously, which used to be due on April 15th, or second quarter payments within our property tax. As for an exact number, I don't have that number. My Chief of Staff, Dan Gilman, would be able to get it for you. But again, that's a photograph. And that only shows where we are today. It doesn't show out the next 3 months in order to be able to make cash flow work throughout the rest of the year. So it's something that we monitor both on the short-term basis of day-to-day, but on a much longer-term basis over the course of the next 3 to 4 years.
Okay. And this question may be more from Wendell Hisrick. Has the city noticed a rise in domestic calls lately? And if so, what's being done about it? Can you be specific on stats in any way?
I do not have the particular stats. However, we can probably get that to you. And who was requesting that?
Amy Wattis.
Is that Amy?
Yes.
Okay, I will have our PIO reach out to you with those numbers.
Thank you.
This is Christine D'Antonio from WPXI. I'm not quite sure who would be the person to answer this, but we have been receiving reports that some businesses in the city of Pittsburgh are basically requiring their employees to go in, that they have not provided PPE, they are not practicing social distancing, and they're doing it kind of on the down low. And they're afraid that if they speak up, that they are going to have some sort of be reprimanded. The person that I spoke with said that they anonymously called 311, additionally contacted the Allegheny County Health Department, and to date, nothing has been done. Can you comment on people calling about businesses not following the governor's order?
What you stated is the right thing to do is reach out to 311, and whether or not it's been followed through, we do have a tracking system on that, and there is a possibility that the officers may have shown up and basically caution them. We're not out to cite individuals at the first time. We would like to try to give them a warning. And if they repeat it, I would ask to call back 311 and we'll follow up on it. Like I said, there is social distancing guidance out there. There's policies out there. But once again, trying to write citations on the first time is probably counterproductive. And like I said, there's a good possibility the officers may have shown up, provided a warning, and they may have not followed it.
Mayor Peduto, this is Marcy Cipriani from WTAE. My question is about a press release from last week. You talked about getting back to work as far as some facilities being repaired, talking about possibly movies in the park and pools. And I know we haven't moved to yellow, but what can you talk about those things? What's happening and what can people look forward to?
That is something that is on an ongoing discussion. So everything from our swimming pools to our water fountains to our spray parks to our playgrounds and ball fields, and whether we'll have Little League this summer or soccer for kids, our summer recreation programs, our senior centers, all will be on a constant evaluation over the course of the next couple of weeks. We'll wait first for the governor to make his ruling about southwestern Pennsylvania, and then we will look first and foremost to the safety of our residents as our primary guide in making that decision. That will also affect the 4th of July celebration within the city of Pittsburgh and any other gatherings where people would get together. Now, saying that doesn't mean that we can't be creative. And if we are to eliminate our theater in the park that allows movies to be shown in our neighborhoods, we're already in conversations of how to bring drive-ins to our neighborhoods and to be able to have people isolated by cars in a drive-in theater that is a pop-up in a neighborhood to be able to still bring people together, but in a safe way. So we'll be open to creative ideas how people can interact, but in creating public policy, you always need to have a true north. And our true north will continue to be the safety of our residents.
Thank you.
Any other questions?
Mayor, this is Joe DeStio at KDKA. I just wonder about the city-county building. Is it once we get to yellow, whenever that is it your intention to get the building itself reopened and employees coming back gradually? What are your thoughts about the city-county building itself?
Yeah, I've been, and I can tell you this, Joe, personally, very, very pleased with the way we've been able to operate through telecommunication. This was something that we didn't even have in the month of February, but during the month of February, we had a Delta team that was comprised of leaders of all the different departments, including IMP, in order to be able to have laptops that were available, in order to make sure that connections were created, ensuring basically that we could create and run a city where 40% of our workers would be infected. That was one of the scenarios that the CDC gave us back in February to plan for. And we've been able to do that. I will not rush the employees back to any of our large buildings, just as I would not rush any of our residents back into any type of social gathering, whether it is indoor or outdoor. Now, a lot of people a month and a half ago wanted to close streets and have an open streets policy, but we were still on the curve up, meaning the infection rates were getting worse and more. And it wasn't a time in order to have that conversation of how we can gather people, even in the outside. The disease still spreads outside as well as inside. But now that we're starting to see the plateau and the downside, now we can start to have that conversation. What will it mean? It will mean a strong evaluation backed by science in order to make informed decisions. And as we go through this, part of that will be the evaluation of the city-county building itself. What will be the first essential workers to come back that need to be inside of this building, and then what the next phases and levels will be until we're back to the point where we were before. I would say that the first step in that is the governor, and then after that, the evaluation. Until we even have the word from the governor, we won't have an evaluation. We will keep our workers at home.
This is Ashley again from the Post-Gazette. So going off of Joe's question and jumping back to Ariel's question, is there any scenario that you see where you would use your powers granted under the state disease law or health law to keep anything, more strict within city limits?
I don't think that there's a mayor in this country that could answer that question. And let me say why. This whole thing is flexible. Anybody who tells you that they know what this virus is going to do or how this pandemic is going to work itself out is not being honest. People want hard metrics and hard measures in an area where everyone is basically writing the rules as we are going through this situation. I think the most important thing that a mayor can do is be open-minded and to be flexible, to be able to see where the statistics are showing us where the virus is taking us, and at that same time, to be able to have a list of priorities in order to be able to make decisions. So if we put the health of our citizens first, it makes it much easier in order to be able to make decisions on how we should be able to respond. But understand, no matter who the politician is, no matter what political party they come from, if they're telling you that they know what the situation will be in 6 months, they're not being honest. You need to be flexible, you need to be open-minded, you need to use data, and you have to have a true north.
Any other questions for the mayor? All right, hearing none. Thank you, Mayor Peduto. Thank you, everyone, for coming.
Thanks, guys. Really good to see you all again.
Thank you.